Hi there, this is Anita with Anita Ray Health. Thank you for joining me today on this video. This is video 3 of our 3-part video series on thyroid health, the introduction to thyroid health. And I am going to share my screen with you today so that you can get all the information that you need if you have lab tests that are abnormal for thyroid. If you want to know if you have these symptoms of thyroid disease, you can watch video part 1. If you want to know what lab testing to get and whether or not you had the full thyroid panel and whether or not your lab ranges are being measured in the optimal range versus a normal range, then you can watch video 2. This video 3 is for people who have had thyroid testing and something is coming out abnormal on it, and they want to know, is there anything I can do naturally to improve my thyroid health and my overall health, and so I can feel healthier and get over these thyroid symptoms. So let's get in here. I have a PowerPoint that I created. There's so much information that I could give on this topic, and I really was struggling on what to cover, what not to cover, because there's so many details. So I put it onto slides so that you'd be able to follow through easier, and you can refer back to the slides in the video as you're going along if you want to see something that you forgot about or missed or want to go back to it. So let's go ahead and get into the PowerPoint right now. I'm going to share my screen and I'll just kind of go through the slides. And I know some of you are like me and you're busy, and so you're listening to these webinars and videos. You're just listening, you're not watching the screen when you're doing it. And if that's the case, I'm going to pretty carefully go over the details in the slides so that if you're just hearing it versus watching it, you'll still get the picture of what we're talking about. Okay. All right, so if you can see here, our topic today, natural strategies for thyroid health. As I said, this is video 3 out of 3 videos that we've done, thyroid introduction 3-part series. If you want to go back and see the other videos, you can go to anitarayhealth.com/thyroid-intro. So it's ANITARAYHEALTH.com/THYROID-INTRO. AnitaRayHealth.com/thyroid-intro. All right, so real quick, I'm just going to introduce myself for those of you who don't know me. I'm Anita Ray, and I'm with Anita Ray Health. And what I do is I help people who are struggling physically and emotionally, and they just can't find relief. Now, when things go wrong with your thyroid, it often causes so many frustrating symptoms in your body and in your brain. And I want people to know that there are natural strategies that are available, and they can help you if you're dealing with thyroid issues, or maybe you have anxiety or irritability, focus and attention difficulties, brain fog, fatigue, insomnia, and other autoimmune challenges. Oftentimes, when you have one thing go wrong in your body, you've got multiple things going wrong at the same time, and it affects multiple parts of your body, your brain, your body, your energy levels, your sleep. All of that gets dysregulated at the same time. And what I do is I help people that are struggling with multiple symptoms in many areas. We figure out what's going on in there with lab testing, and we use supplements and improving sleep and diet and those kind of things to help you get control of your health. That's my goal, is to help you gain back control of your health. And I do offer a complimentary call to discuss your health. And if you'd like to take advantage of that, you can visit my website, anitarayhealth.com. All right, so there are many possible reasons why your thyroid gland might be struggling, and I can't go over every possible reason in this video. It would take a very long time, but in one of the trainings that I've taken for thyroid, I just copied some of the information from there regarding what we need to look for at what might be causing your thyroid gland to be struggling, and what areas you can tackle if you're trying to improve your health situation. Basically, you want to find the missing pieces to your health puzzle. And as you can see on this list, I mean, we've got everything from autoimmune reactions. You could be sensitive to gluten. You might have chronic infections, and this could be a gut infection. Say you have a pathogen that's a gut infection, but it also could be a systemic infection, something that's inflaming your entire body, and you need to dampen that down to help your thyroid and your overall health. It could be toxins in the environment. You could be missing different vitamins. I'm not going to go over everything in here because there's a lot on this list, but you can go back and read through this list. There's just so many things that could cause a thyroid gland to start struggling. And the goal is to figure out what pieces of that puzzle are something that you can do something about. Now, if you have a genetic tendency towards a disease, it doesn't mean you're going to get that disease. If it runs in your family, it does not mean you're going to get it. So there are things that trigger you into that path. And if you can stop those triggers, then hopefully you can regain some kind of balance in your body. And the goal is to help not only your thyroid gland, but your overall body come into balance so you can get rid of those symptoms. Now, a big question I get is, will I need medication? And will that medication actually resolve my symptoms? And, these are important questions I want you to talk with your doctor about. Now, if your thyroid labs are just slightly out of range, it says abnormal or it's in the non-optimal range, but you're still in the lab normal range, like we talked about in video 2, then, your doctor might just ask you to come back and do retesting in a few months, and they might just monitor you over time for changes. Now, if your labs are far enough out of the range and your doctor actually diagnoses you with hypothyroidism or Hashimoto's thyroiditis, then you might be given a prescription and you might be taking something T4, that's a levothyroxine, Synthroid, other names for these kinds of medications. On the opposite end, so you have hypothyroidism, which is the low thyroid function, and Hashimoto's is an autoimmune disease of low thyroid function. You've got the opposite end is hyperthyroid, and that's Graves' disease, and that's where you've got this excess thyroid hormone floating around. Now, in this case, your doctor might discuss with you options such as medication, radioiodine therapy, or even surgery to remove the thyroid gland. Now, any of the above situations are an ideal time for you to start supporting your body. You need to check your diet, your sleep, your exercise, how much are you moving during the day, your stress levels. Are you under extreme stress? What can we do about that? And your exposure to toxins. These are things that are known to throw off the balance in the body. And it's time, if you're having any kind of abnormality in any of your labs, it's time for you to want to figure out what's causing it and take control of it as soon as you can. Now, if you look at the first box here at the bottom, you'll see, thyroid medication is essential. If your body cannot produce thyroid hormone, you need to give it thyroid hormone. You cannot live without thyroid hormone. So always consult your medical provider before lowering or stopping any medications. And don't stop a medication that is essential to you. That is not what the purpose of this webinar is. Now, taking thyroid medication, on the other hand, as you'll see in the second part, the second square, and taking thyroid medication doesn't always provide enough relief. Some people are taking thyroid medication, they had abnormal labs, or they have really bad symptoms of thyroid and they try it out and they're not feeling different. They're not getting enough relief. They're still having a lot of symptoms. And in that case, you need to figure out either A, there's more things going on that you don't know about that are causing your thyroid issues besides a lack of hormone, or B, you may have other issues going on at the same time as your thyroid problem, and those other issues are giving you problems. So you need to make healthy changes. And in doing this, you can enhance any treatment that you get from your doctor. By doing these healthy changes, it's not going to upset your medication, to get more sleep or to exercise at the right level, not over exercise or under exercise, but at the level your body needs. It's not going to hurt to eat more real foods and less processed foods. These things are going to make you healthier overall, regardless of whether you're on medication or off medication, and they're likely to make you feel better. So the final point you can see here is medication alone doesn't address the triggers or stop further damage to the thyroid gland. So if you've got an ongoing autoimmune issue and it's causing destruction, your immune system is destroying your thyroid gland, something is triggering that, and it may be more than one trigger. And if you're not figuring out what that is, you will continue to have more and more damage to your thyroid gland. And sometimes people are getting on higher and higher and higher doses of medication, and they're still not feeling good. And you want to address the triggers as to what might be causing your body to be out of balance. Okay, so I get the question, how do I know what changes to focus on? There's so many things I could do. And that is true. As we looked at the slide before, there's a million reasons why you could have a thyroid problem. But you know what? How you figure that out is that you test. You test, don't guess. That's a motto I learned in my FDN health coaching training, and it's functional diagnostic nutrition. And we talk about test, don't guess. So we do lab work and we figure out, like, okay, what areas am I out of balance here? Am I missing some nutrients? Do I have too many toxins in my life? Is there something going on with my gut? What about my hormones? How do they look? You can test these things. You can figure out based on, your history and what's going on with your life right now. You can check on your stress levels. You can do all these things. And then you can do testing to figure out and fine tune what areas are you going to get the most impact from. Which areas do I need to focus on first to try to get the most impact on my changes, my healthy changes. So test, don't guess is a really important motto that I like to follow. Now, one of the most common reasons for having a thyroid problem is an autoimmune reaction. And we talked about this in video 2. So if you want to hear more about autoimmune disease, what it is, what kind of thyroid testing will tell you if you have an autoimmune disease, then go ahead and listen to video 2 in our thyroid series. Now, autoimmunity is the tissue damage and a loss of function that occurs when your immune system starts attacking your own body. In this video, we're talking about your immune system attacking your own thyroid gland. It can attack other parts of the body too. But in this video, we're talking about thyroid gland. But a lot of the things that we're going to talk about right now about the thyroid will apply to other autoimmune issues as well. Now, people don't always know, why do you get an autoimmune disease? Where does it come from? Does it come out of the blue, or why do I have this? And there are 3 triggers that, according to Alessio Fasano, he's a researcher, and he came up with 3 factors that you need to have in order to get an autoimmune disease. And the link here, if you want to actually read about it, is right here in this video screen, the slides. So number 1 is a genetic susceptibility. There are some people that have 0 history of autoimmune disease, and they have certain genetics that will put them in a place where they are very unlikely to get an autoimmune disease. There are other people that have autoimmune issues everywhere in their families. So many people have it, and they're more susceptible. And then there's people in the middle. And so what I really want you to understand from this video, though, when we talk about genetic susceptibility, is that you are not destined to get a thyroid disease if it runs in your family, if you have these certain genetics, if everyone in my family, every female in my family has autoimmune disease or whatever. It doesn't mean you have to get it. There's 2 other factors that have to happen. The second factor is intestinal permeability. And some of you may have heard this as leaky gut. So leaky gut, there's these tight junctions in your intestines that keep tight, and they open up just a little bit to allow nutrients and other important things to pass through the cells. In the case of intestinal permeability, the tightness of the junctions is not working, and things that are not supposed to escape into your bloodstream are actually getting out. And then once your body sees these things in the bloodstream that are not supposed to be there, it could be undigested food particles, it could be toxins, all these things that are not supposed to get into the bloodstream get in there. Your body mounts an attack and it goes after it, and it causes widespread inflammation in your body, not just your gut. It can be in many places, and including your brain and your skin, and other parts of your body can start having issues because of this intestinal permeability. The third one is of this 3 possible triggers or factors for getting an autoimmune disease are environmental triggers. So there is something that happens in your life, in your body, that has set this process on. it turned the process on. It's like, okay, maybe I have celiac disease, I'm eating gluten and I got an infection and now my gut has gone, into leaky gut intestinal permeability. I have the genes for it. Now I have celiac disease. Same with thyroid. You might have the genes for thyroid. You've got this leaky gut, this intestinal permeability going, where the gut is not able to keep everything in the gut that's supposed to be there, and things are escaping out where they're not supposed to go. And then you get hit by an environmental trigger. It could be toxins that are in the environment, toxins in your food, toxins in the air. It could be exposure at, say, work or somewhere else where you're exposed to a toxin. It could be a gluten could be one for thyroid problems. You might become suddenly sensitive to gluten and it triggers more intestinal permeability, and then that leads to your thyroid hormones. You could get any kind of infection. There's a whole list of infections that you could possibly get, and maybe that's triggering your autoimmune disease to start. So I just want to kind of understand where this autoimmune disease is coming from and what we're, kind of what we're talking about with that. Now, go ahead and go back and watch video 2 of this series if you want to understand the importance of getting a full thyroid panel that includes antibody testing. I recommend for all of my clients that if you haven't had antibody testing and you're taking thyroid medication or you have an abnormal thyroid lab, it's really important to get an antibody test for it. And not every doctor will run that or think that it's necessary, but I still recommend you do it so that you can try to address any factors in your life that might be leading you to be struggling with this issue. I also consider, you want to consider if you have an optimal lab reference range versus the conventional lab standards, because there's a very different lab range, and we talked about in this in video too. There's a very different lab range you'll get if you see a functional medicine doctor or a naturopath and you get testing there. They use very different ranges than what you'll get at a regular lab and a conventional doctor. So your thyroid might be in the normal lab range, but you are very close to going in the abnormal range. And an alternative medicine provider or functional health provider might suggest you start working on your health and supporting your thyroid right away before you really tip over into that totally conventional lab reference range abnormal. Okay. So as I just discussed in the last slide, there's Hashimoto's thyroiditis, the low thyroid hormone autoimmune disease. There's Graves' disease where you have an excess thyroid hormone. And these are the most common thyroid conditions that you'll hear about. And both are autoimmune related. So if you don't know whether your thyroid issue is autoimmune related, you've just been told, oh, my thyroid's low or my thyroid's high, it's still important to find out. And you can't change your genetics number one above of why you might get an autoimmune disease, but you can definitely work on number 2 and 3. You can work on the health of your gut and you can try to eliminate whatever might be triggering this. All right, next screen. Chronic infections and gut health. So like I said before, you can have a chronic infection and it can be an infection overall, like you might have an Epstein-Barr virus and it's, affecting your overall body, or you might have H. pylori in your gut, in your digestive tract, and that could be an infection that's causing you a problem and affecting your ability to make thyroid hormone. So chronic infections can be in the gut or they can be systemic through the body. Most of the time, infections don't directly attack your thyroid gland. Most of the time, it's not that Epstein-Barr virus, the herpes virus, the cytomegalovirus. It's not going in there to your thyroid and it's starting to attack it and destroy it. A lot of times what happens is that the virus is in your body and your body is trying to protect you and it's trying to fight this virus or bacteria or, whatever germ is in there trying to get you. And there's damage that's happening to your organs while that's happening to your cells and your organs. And it can lead to autoimmune damage where your immune system starts attacking your own thyroid. Now, if that damage continues over time, it's not just a one-time thing, it keeps going and going over time, then you can end up with a full-blown thyroid disease. Another thing that could happen is if you have an imbalance in the gut microbiome. I don't know if you've all heard of that microbiome. It's a really popular research topic right now. And they're looking at the balance. Everybody has bacteria and viruses in their body, and there's a balance that needs to happen there in your gut. Some of the bacteria actually give you benefits, and they're helpful bacteria, and they live on you and you help them, and you live in this, good balance there. And some of the bacteria are bad, and some of them just grow out of range. They just grow too much. And when they do that, then that's when you could lead to having what they call gut dysbiosis, or an imbalance of the bacteria in your gut. And that imbalance can affect your thyroid production for many reasons. And we'll talk about different reasons throughout this slideshow. Now, poor digestive function can cause nutrient deficiencies. And if you're not absorbing your nutrients that you're taking from your food or your vitamins, this can also lower your ability to remove toxins from your body. Now, I'm not going to read every single one of these things down here, but there are possible bacterial infections, viral infections, parasite infections, fungal overgrowth, fungus like candida or yeast, and even other possibilities as to why, as to what trigger that could, like a trigger that could happen that could cause you to have thyroid problems. It's not guaranteed that you have one of these triggers. It's just saying that in studies of animals, they have infected these animals with these different infections, and they found in some cases it led to a thyroid problem. You can do more research on that. We need more research on that, but these are just some suggestions of things that might pop up. Okay, so start with the basics, this slide here. Before you go in and say, oh, I have Epstein-Barr, or I have this, Yersinia infection in my gut, you wanna first work on the basics. You need a healthy immune system and ability to detoxify any inflammation and pathogen left or die off that you have. You need that in order to clear out the pathogens. You're not going to be able to fix your gut infection or your systemic infection if you have not already got your body on a healthy level, at least a basic, immune support by your following diet and lifestyle changes. Now, in our FDN program where I trained, we have what's called a Dress for Health Success, DRESS, Dress for Health Success. And it's meant to lower the metabolic chaos that's going all over in your body. The D stands for diet. So we want to eat a whole foods, non-processed diet. We want to keep it low in sugar, low in alcohol, low in any kind of pesticides and toxins that could, low in GMOs. You want to have a really just solid, basic whole foods diet, foods that you can recognize that came from the earth, not a bunch of processed, packaged, canned foods that are have a lot of additives or dyes or chemicals in them. You want to avoid those kind of foods. The R is for rest, and this includes sleep, but it also includes just kind of taking some relaxation breaks and just not overworking your body and pushing it too hard to its limits. Exercise is important, and in thyroid conditions, I've seen it go both ways, where somebody is not getting any exercise at all. And that's understandable, because if your thyroid is low, you feel so tired, you don't even feel like you can get out of bed. So the idea of exercising feels impossible. But you might be able to start off with just some gentle walks around the neighborhood. If you have a dog, take your dog on just those short walks to get going. The other side I mentioned is the overtraining. So some people are just training at the gym over and over and constantly exercising too much when their body is trying to clear a pathogen, or their body is struggling with autoimmunity, or it's dealing with stress, excess mental or emotional stress, and you're just pushing it and pushing it. You don't want to go that end either. You want to figure out what is safe for my body right now, and what exercise you can do right now might not be what you can do a month from now or 2 months from now. So you kind of have to judge your body and see where you're at, and keep your exercise level to the level that's healthy for you. Now, the first S in DRESS is stress management. And people don't always understand this. They sometimes get confused. Now, stress is not just mental and emotional. Yes, you can have definite stress. You can have stress about work. You can have stress about health, stress about family members. You can have stress about your boss at work. You can relationships. There's a lot of stress you can have in a lot of ways, and that brings on mental and emotional stress. Maybe even stress with your bills or your ability to afford your essentials is causes a lot of stress. Now, what people don't tend to understand is there's also a biochemical stress that can happen. And so stress is not just the mental or emotional part. It can be that you have a parasite, you have a pathogen, that you're eating a food like gluten or maybe dairy, and it's triggering antibodies in your body, and it's really stressing your body out to eat that food. Maybe you're being exposed to something like mold. Maybe you have Lyme disease. Maybe you have some kind of toxins in your house. Maybe you've got toxic cleaning chemicals. Maybe you're eating foods that are damaging to your body. These can cause biochemical stress. And that's another type of stress that you got to look for. And that's what we do a lot of times with the testing. We're trying to figure out what are those biochemical inside physical stressors that are causing my body to not be able to function correctly and not produce enough thyroid hormone. And last one is supplements. Now, I don't think that supplements, you want to just take every supplement out there and overload yourself, but you know what? There are supplements that can help support you until you get your body on track. There are supplements that can give you extra nutrients until your gut is able to digest extra nutrients, because you might not be able to digest enough from your food. You may need extra. And some people might have a genetic issue where they're not able to absorb enough of the vitamins from their food, and they may need extra vitamins. It just depends. Or you might be clearing out a pathogen, and there might be a supplement that can help your gut lining to heal. So there's a lot of things we can talk about with supplements, and I'm not going to go into that today because it's just too much of a topic. But just keep in mind there are some things that might help support your body along the way as you get back into balance. And there's a concept that I learned in my FDN training, and also in just the way that I've been looking at the body and seeing how things can be improved or not improved. I strongly believe that our bodies have an innate wisdom and an ability to keep us healthy. So your body knows what to do to keep you healthy. Your cells know what to do. They have a job. Every one of your cells has a job, and it knows what it is, what it's got to do. But sometimes your body needs your help. It needs help in removing what's standing in the way of your body doing its job. And so if that thing standing in the way is a toxin or a parasite, or it's gluten or dairy or some other food that you're sensitive to, whatever it is that's in the way of your body's doing its job, it's sending you these symptoms, and it's saying, help me, I need help here. I'm not doing well. You got to stop that thing from hurting me. So your body's like sending you symptoms. It's giving you signals that you need to do something about it. Now, if you remove those triggers, whatever they are that are causing your body to go out of balance, then your body and your cells are able to get back to doing their job and keeping you healthy just like they want to and what they know how to do. And I want to point out that the longer you wait to make changes, the harder it's going to be to repair. And if you just start to go a little abnormal on your thyroid testing and you're not that far off and you have a little bit of damage, wouldn't that be an ideal time for you to start working on these triggers and supporting your body and supporting your thyroid and eating a healthy diet and getting sleep to help your immune system? That's the ideal time to do this. Even if you wait till later and you've had a lot of thyroid damage and you're on medication and you're going to have to take that forever, there still are a lot of things you can do to make your body healthier and to feel better. So wherever you are in the process, definitely start working on supporting your body. But if you're just barely starting into that, it's the best time for you to jump now. Don't wait until you feel so miserable that you can't get out of bed and you have no energy and you're gaining weight and your hair's falling out and you just feel absolutely miserable. Start tackling it now so you can keep everything under control. And if you have gotten that far, don't feel hopeless. Like, there are still things you can do. If you've got full-blown thyroid disease and you're feeling awful, there are still things you can do about it to support your body and help you with your overall health and feel better. All right, let's talk first about food. Well, we talked about infections as the first, possible trigger. Let's talk about food and diet choices. What I tell all of my clients, and I truly believe, and this is a problem for me too, it's really hard, is that keeping your blood sugar stable. It's absolutely critical in controlling inflammation. If your blood sugar is going up and your blood sugar is going down, and you're eating foods that are spiking it up and down, there is no way to control inflammation if your blood sugar is going all over the place. So you need to be careful in how much sugar you're eating and how many processed foods you're eating. A lot of those refined grains and processed foods, fast foods, they're going to spike your blood sugar a lot. And then you're going to fall down on your blood sugar and you're going to be more hungry and you're going to go eat more of those foods to pull your blood sugar back up. And you're going to get stuck on this blood sugar roller coaster. And that's something that is really something that you got to watch if you want to control inflammation in your body. Next thing is to find any food reactions that you have. There's a couple ways you can go back about this, finding your food reactions. You can try an elimination diet or you can do testing. It's hard to do an elimination diet. You've got a lot of things going on at the same time. If you're doing an elimination diet, you're probably eating healthier food in general. You have to be careful in how you introduce the foods back again so you can figure out which food is causing you a reaction or not. And you have to wait several days in order for you to eat one food for a couple days, wait a couple days, see what happens, because it isn't always like you eat a food and you immediately have a reaction. You might eat a food and have a headache 2 days later, or you might eat a food and the next day get some eczema on your skin. It doesn't always happen immediately, so it's not always easy to tell if you're having a food reaction. Testing is helpful. There's a lot of different food sensitivity testing out there. And I'm not talking about the testing you get at an allergist for a peanut allergy or a shellfish allergy or some kind of IgE allergy. I'm not talking about that kind of testing. I'm talking about one that is not so easy to identify, something that's behind the scenes and might cause a low grade reaction or a delayed reaction. And that's what we do testing for, to try to figure out, is there a food that's bothering you? You can also check the permeability of your gut when we were talking about leaky gut, and try to find out if there are any if how healthy your gut is, and then look for some foods that might be like contributing to that permeability. And what you want to do is remove those foods that are causing you the problems, and then check out, kind of monitor your symptoms, see how they're going, and then you can repeat the lab work at a later date and see if you've been able to lower the reactions. Now, the number one food, the most often food to cause a problem in an autoimmune disease, is gluten. And gluten is found in wheat, rye, barley, and some oats. The oats that do not say certified gluten-free probably have gluten in them. And gluten is just a molecule, like a peptide. It's a piece of a protein that's inside of wheat, rye, barley, and some oats. Now, this protein, this gluten, it's a really hard thing to digest, and it may play a role in many people who have thyroid autoimmune disease. Now, of all the possible food reactions, gluten is the most important to remove, but there are others that might be a possibility, other foods. You want to also, as you get diagnosed with a thyroid disease, you may want to ask your doctor if you can also get celiac disease testing. Celiac disease is an autoimmune disease directly related to gluten, ingestion of gluten, taking gluten in. Having thyroid autoimmune disease put you at risk for other autoimmune diseases. So that's why, you want to monitor yourself for other issues that may be coming up, and talk to your doctor if you need to ask if you need to get checked for any other autoimmune diseases. Now, if you're going to remove gluten and do a challenge and try to, calm your body down from removing gluten because you think you might be sensitive to it, you cannot cheat. You have to be 100% gluten-free. If you even take the tiniest little speck of gluten, you could be, causing the inflammation there. You could have croutons in your salad and you just pick them off, and eating that could be enough. You could have somebody making your food at home with the same spoon they made somebody else's pasta with, and putting that spoon from the one pasta into your gluten-free pasta. could actually cause you to have a problem with gluten. So you need to not cheat. You need to read labels on the packages, and you need to ask questions whenever you're at a restaurant. You want to make sure if you're bothered going to the headache of doing a gluten challenge, do it 100%. You don't have to do it forever to do the gluten challenge to figure out if it's a problem. It's not do this forever. It's do it for a few weeks, put it back in, see what happens. Now, if you have celiac disease or you have a lab test that says, hey, I'm really reacting to gluten, you don't want to eat gluten at all. Then you want to stay 100%. So there's a difference if you're testing it out just to see, am I sensitive to gluten versus, yes, I'm sensitive to gluten. You need to be 100% in that case. Now, some people have celiac disease and they can never eat any gluten ever. Like that, it's really, really damaging to their body. Other people have what's called non-celiac gluten sensitivity. Now, these people, they may not show up on a celiac disease test, and they may have you could have an endoscopy where they're checking your intestines, and they may not show all this same inflammation in the intestines that you have in celiac disease. But people can have non-celiac gluten sensitivity and have a lot of other reactions like skin reactions, headaches, brain fog, fogginess in your brain. You can't think clearly. You can have pain in your body. You can have sleep problems. There's a lot of problems that could happen that are, not only digestive related. You can have problems with gluten that are not digestive symptoms. It can cause a lot of other issues besides that. So keep that in mind. And of those who react to gluten, many of them find that dairy is inflammatory too. There's other things like corn and soy and, other grains that you might be sensitive to, but gluten and dairy seem to be the top two that you see recommended if you have a thyroid autoimmunity and you want to try an elimination diet. Other things to worry about with inflammatory foods would be processed foods. We talked about that, refined carbs, foods with heavy metals. If you're eating seafood that's really high in mercury, then you need to go look at the list of what seafood is safer. Poor quality proteins that are, really bad meat that has a lot of antibiotics and things in there. You need to, maybe consider going for grass-fed proteins, organic proteins, that kind of thing. Food dyes in your food is not a good idea. Preservatives in the food. So not only are you thinking about specific foods, but the overall quality of the food that you're eating as well. All right, so we mentioned toxins. And there are so many toxins in our environment. It's actually quite scary. The more I read about this, the number of chemicals, pesticides, heavy metals, and even what's called mycotoxins. And mycotoxins can be things in the environment that are related to molds and fungus. And they can actually be in your home, and you could be breathing them in, and it could be causing you mold sensitivity, mold toxicity, and other types of mycotoxin illness in foods or in your home environment. Just as an example, I was just looking through some information. I want to give you this example. There was a 2005 study on newborns. So this was, 15 years ago. It's probably even worse than it is now. But the Environmental Working Group, I found this article on their website that you can read it. The link is here. But there were 287 chemicals found in newborn umbilical cord blood. So the blood of a newborn that was just born had 287 man-made chemicals in their blood. Now, 180 of those chemicals are thought to cause cancer in humans or animals. 217 of those chemicals are suspected to be toxic to the brain and the nervous system. 208 of those chemicals might cause birth defects or abnormal development as shown in animal testing. So think about this, 287 chemicals. We don't even know how many of those chemicals have been researched for safety. Then you mix them all together and get exposed to 200 of them at a time. You imagine that's got to be even worse than having one chemical individually. So it's really pretty scary. You really, really need to, for yourself, your family, your loved ones, figure out a way to start lowering these toxins in your food, in your environment. Now, it's going to be impossible to avoid all toxins, they're everywhere, but that doesn't mean you can't make changes that are beneficial. Every step that you take to lower your toxic load and the load of your family members and your loved ones, every single step counts. So even just take one step at a time. Today, I'm going to look up the list of what foods I need to buy organic, which foods have the most chemicals. Then I'm going to change out one of my cleaning products. And each time as you make a new step, you're doing that much of an effort, much of a difference to help you and your family. Now, I have some lists here that you can go to, and you can look these up on the Environmental Working Group website, EWG. They're really tons of great information on how to reduce your toxic load. The first link here you can see is having cleaner food. They have what's called a dirty dozen and a clean 15 list. So this will tell you which foods have the most pesticides in them. So you're encouraged to buy more organic, and then which ones are the least likely to have pesticides and chemicals in them. And then those are the ones, if you're on a tight budget and you can't buy everything organic, then you at least know that you can just go ahead and buy those foods. So it's kind of like a when to buy organic. And they update that list every year. So the 2020 list just came out. Safer home cleaning products. They have a guide there. So look up your home cleaners and start figuring out if you can buy some more natural products. Maybe you want to start making your own. They'll give you lists there. Next one is safer makeup, cosmetics, personal care products. This is a huge deal. So many of us are putting on this makeup and lotions and using shampoo and conditioners and soaps and all of these things that have toxins and pesticides and heavy metals and chemicals that are like, soaking into your skin and causing you product problems. And if it's lipstick, it's getting into your mouth, and if it's on your skin, it could be, going in that way. You want to make sure, and even if it's like, say, a hairspray, you're breathing that in. So there's a lot of ways these toxins can get into you, and the more things you can change in your personal care products, the better. Last one is to filter your water. There's still a lot of gross stuff in your tap water. They filter out some things, but there's a lot of things that are going into the tap water. So you can go to the Environmental Working Group's website, ewg.org, and you can find any of these lists, but this one's ewg.org for their tap water. They have a water filter guide to help you figure out what to buy that will help you filter that out. Next one is nutritional deficiencies or nutritional toxicity. So nutrients can be either too low deficiency or too high toxicity and cause a problem for you. So we know that the nutrients, vitamins, minerals, these are vital to proper thyroid function. You need to have vitamins and minerals for your body to set forth the process that needs to digest the food, to absorb the nutrients. And then you need those vitamins and minerals to form to do your thyroid function, to produce your thyroid and distribute it to the body to where it needs to go. You also need enough vitamins and minerals for good energy levels, for a happy mood, to not be anxious or worried or irritable or stressed out. Your mood, you need vitamins and minerals to produce neurotransmitters. For your brain function, to be able to concentrate and focus, you need vitamins and minerals. And just for your overall health, for your body to really function well, nutrients are important. Now you want them to be in the right balance, kind of like Goldilocks, not too high, not too low. And in some cases, it's not just that you have enough vitamins or minerals, but it's the ratio of those minerals that are important, because taking more of one vitamin could affect another vitamin, or more of one mineral could affect another mineral. Sometimes it's the total amount you don't have enough of, or you have too much, and sometimes it's the ratio and how it compares to other ones. There are several nutrients to pay attention to. I don't have them all listed here, but here are some of the critical ones they have that you want to look at, and it's selenium, zinc, magnesium, iodine, iron, and copper. And the balance of these, like a zinc and copper balance, you may need to, iodine can be too low or too high and cause thyroid problems. Overload or excess or deficiency of iron can be a problem. They swing both ways. So you don't want to take too much selenium or not, you could be toxic. But if you don't have any selenium, you could have a thyroid problem. So it's really important to work with someone when you're trying to balance out your vitamins and minerals. All right, so let's do a little summary here. Now, if your thyroid testing is abnormal, first of all, you want to find out if you have an autoimmune related issue. Do you have Hashimoto's or do you have Graves'? Not just, do I have hypothyroid, my thyroid's low. You want to know, do I have an autoimmune low thyroid issue, so that you can start working on some of these things that we talked about. Even if you had general hypothyroidism, you could still work on all these issues. It's going to help you. But know if you have an autoimmune disease, so you can track if what you're doing is actually helping you and lowering your antibodies. Second one, follow your doctor's instructions regarding your medical follow-up and medications. So you may need medication for your thyroid function. And if you do, you need to take it. Listen to your doctor, follow the advice, take it how you're supposed to. Don't stop your medication. Don't go try a natural thing and say, I'm just going to stop my medication. Don't do that. Follow what your doctor is saying, but do understand that just alone taking that medication might not give you enough relief. You may need to do other strategies, and you likely will be better if you do, like, you'll feel better if you do more than just taking the medication. You likely need to work on your diet, your rest, your exercise, your stress, your sleep, your nutrients, and getting the right supplements to work on your gut function. There are things that can help you take your health up another level beyond just taking the medication. I already said this, but it's important to support your body and your immune system. This will help you in so many ways besides just your general thyroid function. If your body is going out of balance now, it can go out of balance even worse, and you don't want to end up with even more things wrong with you. So it's important to just, work on supporting your body. Give your body what it needs so that it can do its job. Now, here's the following issues that we talked about. There's more than this, but these are some of the main ones I would start looking into if you have a thyroid problem affecting your health. First one were the autoimmune reactions that we talked about. Second one was your food and diet choices. What are you eating? What are you sensitive to? That kind of thing. Third one, we got chronic infections and gut health. So it could be that you have a parasite, you have a bacterial infection. Maybe you have an imbalance in your gut health. Maybe you're not digesting things. Maybe you don't have enough stomach acid. There could be a lot of things with gut health that are causing an issue. Toxins, we talked about going to the environmental working group website and start figuring out one step at a time. Just take one step at a time. Today I'm going to do this. Next week I'm going to take out this. Tomorrow I'm going to look at my diet. Next week I'm going to change out my personal care makeup products. I'm going to get a healthier deodorant. Whatever it is, you're going to, just take it one step at a time. You don't have to do this all at once. And if you have someone to help you, it can be easier to go through these steps. Final one is nutrient deficiencies, and that one is something you'll need help with. You can't just start taking a bunch of vitamins and minerals, and you don't want to overdose on anything, take too much, and you don't even know without testing to know what you might need more or less of. So that's an important one to get help with. Test, don't guess is what we talked about. It's important in figuring out any of these items, and a functional health practitioner can help you figure out what is standing in your way so that you can do something about your thyroid health. I just want to end this video here, that there is hope. I know it's hard. You feel so, like, if you have a thyroid problem, you can feel like so down and no energy to do anything. It can be impossible to even function at home or at work. These symptoms are, they're really, they can affect so much of your daily life. They can affect your relationships and that. And I understand that, but there is hope. There are things you can do to feel better. So you don't have to suffer with these issues. You don't have to have fatigue and anxiety, a sluggish metabolism, a foggy brain that can't remember things, can't think. And you don't have to have your hair falling out. All these symptoms that come with thyroid problems, you can do things. You can take charge of your health and try to work on them. And I also want you to know it's not all in your head. And if you go to the doctor and you get a normal lab test, but you have all these symptoms, it doesn't mean nothing's wrong with you. It just means you're not at a level where they are detecting it on their conventional medicine test. You don't have to, don't have to struggle with this, and you don't have to do it alone. And if you'd like to talk about how you can gain back control of your health, and you're interested in really addressing these issues, and you're just ready to take charge and get, past this, you're done with it, you don't want to feel like this, it's affecting your life, then you can book a complimentary call with me. And you can do that at anitarayhealth.com/schedule. anitarayhealth.com/schedule. And what I like to tell people I do is I help you to discover what your body needs to finally feel great inside and out. Everybody is different. Nobody is the same in what they need, or what caused their health issue, or what their lifestyle is, or how they're going to be able to tackle this. Do they want to jump in? Do they want to do little steps at a time? Everybody is different. So when you're trying to work on your own health, you need somebody that's going to individualize and personalize the situation to you, to your needs, to your life, to what you have going on, and help you that way. If you have any questions or comments about this, if something's confusing to you, you want to know what, like how this applies in your situation, you want to know more about my services, you can connect with me. You can message me on Facebook. I'm under Facebook. I'm under Anita Ray Health. I have a website, anitarayhealth.com, email contact@anitarayhealth.com, or you can follow me on Instagram under Anita Ray Health. I'd be happy to chat with you and see what's happening, and just, kind of give you some idea on what next steps you can take. And for those of you who are interested in really tackling this, like I said before, I offer a free first phone consult where we can just go over things. I can tell you how I work, and you can let me know if you're interested. But I do really hope that if you're having symptoms and you're struggling with your health, that you understand there are things you can do. It's not hopeless. And if you do the overall general things to improve your health, you can improve more than just your thyroid. You can improve how your brain is functioning. You can improve your energy levels. You can improve your sleep. There's so many things that people don't think about. They just run out and, take a medicine and try to cover up what's wrong. If you dig in and figure out what's going on with your body, there are so many ways that you can improve your daily life and your health and your ability to function and be productive, be more productive, to get good sleep, and to have, just a happy, healthy mood and a calm, clear mind. And that's what I want to help people with. And I want you guys to understand. So thank you for joining me today on our natural strategies for thyroid health. And if you want to watch the other videos, you can go to anitarayhealth.com/thyroid-intro. And I look forward to seeing you on other videos.